We are more than a year out from the presidential election, but already debates are heating up on a handful of issues. One of the top issues Democrats are focusing on right now, health care. Some of the most heated exchanges during last night's debate was over the health care reform idea. Joining us now to break down this debate, Washington Post health policy reporter Yasmeen Abutaleb. Yasmeen, thanks for being with us. First of all, a big part of the argument last night centered around a push on behalf of some of the more liberal candidates for a Medicare for all system. What kind of system would that look like?
So if we're talking about the more liberal candidates, then we're talking about a system where everyone in the U.S. would be on Medicare. So everyone in the U.S. would be on a government-run program. If we're talking about some of the more moderate plans, then we're still talking about a role for private insurance.
There was also a public option. So explain what that looks like and how would that differentiate from a Medicare for all system?
So the public option plan would essentially allow Americans to buy into Medicare if that's what they want. But if someone likes their employer plan or Obamacare plan or another form of health insurance that they have, they would be able to keep that.
And you mentioned Obamacare, the Affordable Care Act. Is there any indication if any of these plans were actually to be put in place, how they would affect the Affordable Care Act?
If we had one of the more progressive Medicare for all plans where the candidates talk about upending the whole healthcare system and getting rid of private insurance, that would mean also getting rid of Obamacare, where there's very much a role for private insurance. So this would be implementing an entirely new health insurance system. If we're talking about candidates' plans where they talk about having a public option, you would still have Obamacare, but you'd be expanding on the gains made under that law.
So what's the argument behind a Medicare for all system? Why do those who support it say that this is a good idea?
So the progressive candidates, and there are obviously more moderate candidates who support some form of this as well, say that U.S. healthcare costs are far too high, and there needs to be a larger role for the government to negotiate prices with hospitals for what they pay for hospital services, with drug companies to decide what we should be paying for prescription drugs.
And now, are there some within the Democratic candidates who are saying if we propose the idea of getting rid of private insurance altogether, this could be a real detriment to Democrats taking the White House in 2020?
Yes, absolutely. I mean, you saw that play out in the debate last night. These more moderate candidates attacking Bernie Sanders and Elizabeth Warren for wanting to get rid of private insurance altogether, saying that that would be enormously disruptive to the healthcare system, and that the majority of Americans, which is 170, 180 million people, who have a private insurance plan through an employer, like their plan and don't want to get rid of it. And so the argument was we shouldn't be taking away something that many Americans actually like. We should be looking to expand insurance to people who are uninsured or underinsured in different ways, but preserve the option of letting people buy private insurance if they like it.
All right, Yasmeen Abutaleb from the Washington Post, thanks so much for being with us tonight.
Thanks for having me.